When you think about a cancer patient, you probably think of someone older or perhaps a small child fighting for their young lives.
But more than 85,000 teenagers and young adults are diagnosed with cancer every year. This week is Adolescent and Young Adult Cancer Awareness Week.
I spoke to a young woman about why she wants people to know cancer can affect this age group as well. At 19 years old, Sabri Sneller was just embarking on her life.
I graduated high school in May, and a few weeks later I started cosmetology school. Since I was little, I've always dreamed of being a cosmetologist.
But she started not feeling well and went to her doctor, who ran some blood work.
I was on a car ride home and got a phone call that I had acute myeloid leukemia and that I needed to rush to Helen DeVos.
Her life changed course completely with one phone call.
I threw my phone in the car and I just started screaming, crying that something's gonna happen to me.
Next came treatment.
I got my port placed and then I started chemo.
3 rounds and a bone marrow transplant.
It was really hard for me because all my friends were going out and living life, and here I was just stuck and my life was just on pause.
It's a common feeling for many young people diagnosed with cancer.
They are faced with big life decisions, and a lot of them early on.
Christy Woodwick and Rachel Laughlin
I work with patients ages 14 to 29 years old.
work with the Adolescent and Young Adult Cancer Program, or AYA, at Helen DeVos Children's Hospital.
They're ready to start their lives. They're ready to head into their careers. They're ready to start their families, but they get diagnosed with cancer.
There are often different things to consider for this age group compared to others diagnosed with cancer.
If we expect people to have outcomes where they're going to live long lives after they are done with cancer treatment, we should also be early on addressing the needs that they may face as part of those long lives.
Needs like college studies, career management, social needs, and fertility. It's something Laughlin says many cancer survivors say is often overlooked.
That they got to survivorship without knowing that the treatment they had gone through significantly impacted their fertility. And that is heartbreaking and it's not fair. They deserve that.
I'm not able to have kids anymore.
It's a conversation.
Yeah.
Tough for Sabri.
And that's very hard for me because I've always dreamed of having kids.
AYA works with patients to talk about fertility options before cancer treatments. They also plan social events, going to places like escape rooms, ropes courses, and haunted houses.
We want to provide joy for these patients and do something normal.
After her transplant, it took months and months for Sabri to start to feel closer to normal.
I think it's a big thing that people need to understand because it's real.
And she wants others to realize many young people like herself are dealing with the unthinkable.
I think to myself, it's like, yes, I struggled for a while too, but here I am and I'm stronger and I'm better and I'm healthy. And that's all I can be grateful for.
And those with AYA say they are also hoping to raise awareness about young people with cancer. This helps people who generously donate to Helen DeVos to think about these older patients with the items they give. Also, Sabri has a pretty incredible bone marrow transplant story. We talked to her again and her donor in a story coming up later this month.